afternoon. It's an honor to host our latest City of Gary COVID-19 update. And today I'm proud to be joined by our very special guest, Dr. Christina Box, the Indiana State Health Commissioner, as well as Commissioner of the Gary Health Department, Dr. Roland Walker. There have been many developments since we had our last COVID-19 update, and I'm excited to share more good news today. As you likely know, the federal government, through the Federal Emergency and Management Administration, or FEMA, as we've come to know it, has worked with the Indiana Department of Health and the Gary Community School Corporation, as well as Dr. Walker at the Gary Health Department, to provide up to 2,000 COVID-19 vaccinations every day right here at the historic Roosevelt High School. Now, this site offers both drive-through and walk-up vaccination services for anyone over the age of 16. In fact, it's been a very popular offering for all Hoosiers in some areas across the state, but also persons from Illinois have gravitated over here. And so, to me, it's important that our families, friends, and neighbors understand how critical it is to get vaccinated against this deadly disease. And we're trying to encourage everyone here in the City of Gary, certainly, to participate. It's a simple process. All you have to do to get access is go to ourshot.in.gov and register for your vaccination. If you don't have internet access, the state of Indiana has set up a special number to help you get registered, and you simply dial 211. And someone can assist you on that site. Or you can call our local health department and register for the vaccination. Once you're registered, you'll receive a message or an email confirmation of your appointment, and if you need a ride to the vaccination site, you can contact GPTC, or Gary Public Transportation Corporation, at 884-6100 extension 0, and they'll assist you with getting transportation to the vaccination site, as well as a return ride back to the location in which you were picked up at. Additionally, I want to thank the federal government for the new rental assistance that's available for tenants and land. And take advantage of it. So if you plan to apply, you certainly want to visit lakecountyIN.care or call 685-1499 as soon as possible to contact the folks at Geminus, as I previously mentioned. Finally, before I bring Dr. Walker up to the podium, I want you to know about the COVID-19 Funeral Assistance Program, which is administered by FEMA. If you or someone you know has incurred funeral expenses as a result of someone who died after January 20th of 2020, you're eligible for this assistance. We don't have enough information to go into great detail, but if you want to apply for this assistance, you can call FEMA's COVID-19 Assistance Hotline at 844-684-6833. You can also go online to apply at the disasterassistance.gov. Once again, that's disasterassistance.gov. And any question that you have can be obtained, as I said, from the FEMA site or by the number that I just provided. I know that's a lot to take in, but we'll provide this information on our City of Gary's website also at gary.gov. And now, without further delay, I want to welcome Dr. Walker. Dr. Walker.
Well, good afternoon to the citizens of Gary, Mayor Prince, Dr. Box. Appreciative to be standing before you today. Today will be the easiest update I've had to do so far in the last 13 months because we have Dr. Box here who will be able to give you information, so making my job just a little bit easier. I will start off with the updates for Lake County First of all, if you've noticed, Lake County has gone to yellow as an alert system. So our positivity rate now is 6.7 and our unique positivity rate is 12.2. You notice that's a little bit up. You're noticing nationally we have a little bit of an uptick. Particularly our neighbors around us, Michigan and Illinois, are seeing significant increases. So we're mindful, as we're still in a good position here in Northwest Indiana, but we are seeing increases. There's 67 new cases in Lake County in the last 24 hours. So it brings our total up to 51,038 total cases in Lake County. Unfortunately, we had one new death in Lake County. So we've had a total now of 935 total deaths in Lake County. Turning to Gary, Indiana, we had 8 new cases in the last 24 hours for a total now of 5,331 total cases. Fortunately, 0 deaths in the last 24 hours. Unfortunately, 153 total deaths. So if you're looking now, our 7-day running average has gone up. It is now a little bit over 8 cases per day for the 7-day average. So that's something that we want to be mindful of. And since I've told you that, we do continue to have a mask mandate in the city of Gary, but as you're aware now, we have loosened some restrictions. Our capacity restrictions have been loosened somewhat, but we still continue to have a mask mandate, and we still continue to encourage to have social distancing in all indoor places, and we ask that that continue. I want to tell you places now where you can get vaccinations. I think that's really important. I know that we've been flooded with information. As we have been blessed to have a partnership with FEMA, the Department of Justice, Indiana State Department of Health. I am greatly appreciative of the project we have at Gary Roosevelt, which is 7 days a week. It's going to continue for 8 weeks, where we are doing the Pfizer vaccination, and the hours are 9 to 7, 7 days a week. So we encourage people to continue to go out there. We want to push for local participation. We are removing barriers. Yesterday was a really exciting day as we had more than 200 people walk up to get their vaccination. So we do have the capability, if people are coming and appointments are available, to be registered on site and possibly get vaccinations that day. We are also doing vaccinations at the old Holy Angels Gymnasium, and we're doing that on Mondays, Wednesdays, and Thursdays from 9 a.m. to 5 p.m. And then at the health department on Saturdays from 9 a.m. to 2 p.m. We want to remind everybody that testing is still going on at the Gary Health Department, at GNS, and at Hudson Campbell. You may have heard on today that there is a pause in the Johnson & Johnson 1-dose vaccination. So that pause is out of an abundance of caution. There were 6 cases in over 7 million vaccinations, so that's less than 1 in 1 million. And those were females who had blood clots, and those ages range from 18 to 48. So don't know that there's a definite association between the vaccination and those clots. We're just out of an abundance of caution. We are studying that now, and that is why it is recommended that we pause using that vaccine for now. If you're looking to get vaccines, you can go to the state website. Obviously, you've heard me say before, it's our www.ourshot.gov site where you can register, as well as you can call the 211 state number, and you can get assistance by phone to register for vaccination. And then there is our local number, and I'll repeat these again in a moment. But our local number is area code 219-318-0675. So let me repeat those again so that we can scroll those across the screen. But the www.ourshot.gov is the website that you can go to register for vaccinations. The state has provided us with the 211 opportunity to call to get assistance with registering for vaccinations. And then locally, you can call 219-318-0675. Now, like I said, this is the time when my job gets to be as easy as ever been. I get to introduce our state health commissioner. I'm very, very proud to introduce our state health commissioner, and Dr. Christina Box.
Thank you, Dr. Walker, and thank you, Mayor Prince. It's such an honor to be here today, and I really just want to take a moment to say that this has been an incredible day for me. We came here, our team, to make sure that we could bring vaccines and remove absolutely every barrier that we could possibly think of to the communities here in Lake County, and specifically in Gary, to getting vaccinated for COVID-19. I know it's no surprise to you that our minority populations throughout the state and across the country have suffered disproportionately with regards to the number of COVID-19 cases, the number of COVID-19 hospitalizations and deaths. In fact, when we first started looking at having a FEMA site here in the state of Indiana, our first look was at Marion County, which obviously has a higher social vulnerability index, has a higher incidence of our minority populations, and at Lake County. And when we looked at Lake County, it was very clear that Lake County overall disproportionately has suffered significantly with regards to 103% higher rate of hospitalizations when you compare the African American population to their white counterparts, and a 60% higher rate of deaths from COVID-19, again, when we compare our African American Hoosiers compared to our white Hoosiers. And so it was very clear to us where this site needed to be, and we are incredibly proud to be partnered here with Dr. Walker, with Mayor Prince, and with all the community-based organizations here in the Gary area. We are, as always, very proud to have our Indiana National Guard associated with us. We have other individuals from our Title X troops from across the United States. Of course, the school system was so kind to allow us to use the Gary Roosevelt site, and it's been incredibly heartwarming to see the individuals and talk to the individuals that have come up, and they have shared with us what that site and what that school has meant to them throughout their lives. So I found it even more appropriate as we've worked together as a team to try to make sure that we are vaccinating Hoosiers. What I do want to say is that as we've looked at the site and we are analyzing our data, what we are finding is that about 50% of those individuals who are registered are coming from Illinois, which is fine because we know that this virus does not respect any boundary. It doesn't respect zip codes, it doesn't respect state lines, and so that's fine. But what I do want to say is that it's really important to us that when we finish in 8 weeks, that we can look at the zip codes in the targeted areas that we wanted to make sure that we were reaching and know that we have vaccinated a significant percentage of those zip codes. We do know that more men are getting vaccinated right now than women, about 51% to 49%, which is unusual. We don't usually see that. And we do know that a higher percentage of African Americans, about 18% of individuals at the site are African Americans, and about 11% are Latino, which is awesome. We do want, however, to make sure that the targeted zip codes that we specifically have looked at, and we've compared the social vulnerability index, we've compared the percentage of individuals that are being vaccinated, we know that we are getting those targeted zip codes. And right now, about 32% of our individuals that are scheduled are from those targeted zip codes. Overall, in the state of Indiana, just like the rest of the country, unfortunately, we're seeing African Americans getting vaccinated at a rate about half that of their white counterparts. So we know we've got our work cut out for us, but today has been an incredible day. Our team has been here. We have met with Prophetess Peoples and many, many of our faith-based leaders. We'll be going tonight to a revival to talk to even more leaders there. We also had the opportunity to have 2 individual meetings this afternoon with many of the leaders, those influencers within the communities, whether that was the Urban League or the NAACP or individuals from the hospital system and many community-based organizations to partner with us to make sure that we're getting this message out. It's really important that the message comes with regards to the safety and the efficacy of this vaccine from individuals that are trusted within your community. I do want to just briefly mention what Dr. Walker mentioned, and that is the J&J pause. The state of Indiana, just like the FDA and CDC, has decided to also pause on J&J until there is more time for us to look at these cases. I do want to emphasize what Dr. Walker said, and that is 6 cases out of 6.8 million J&J vaccine doses that have been given in the United States. So definitely less than 1 in a million. But if that's part of your family or that's you, I know that's 100%, and I'm not trying to downplay that in any way, shape, or form. But what I do want to say is that J&J has only amounted to about 4% of the 3.5 million doses that we've put in Hoosiers' arms. For the most part, we've been putting Pfizer vaccine and Moderna vaccine in the arms of Hoosiers, and we've been doing that since mid-December very, very safely. We have not seen these kind of problems. So I encourage you to get out to the site. We have got Pfizer vaccine out there. We will continue. Our last 2 weeks are supposed to be J&J. If for some reason we do not deem that safe, and the CDC and the advisory committee for our immunization practices has not cleared the way for us to use J&J, then we will substitute either Moderna or Pfizer at that point in time. And I just want to say it's a real pleasure to be here in Gary, Indiana, to get to know the community and to have the opportunity to serve you. Thank you. Mayor Prince?
So you've heard from Dr. Box and Dr. Walker, and I'm certainly very pleased that both of them could attend today. But we also have a couple of additional special guests. In fact, there's 3 ladies that I want to recognize and just acknowledge their presence. They're from the southern part of the state, all represent areas of healthcare. And so to that extent, we're certainly pleased and just proud to have them here in our city and share the information that they have prepared and brought to our constituents as well. And those ladies are Antoinette Holt, rather. Let's do it all over again, right? Antoinette Holt. She's the director of the Office of Minority Health. And as I said, she's visiting us today along with Dr. Box. We also have Terry Lee, who's the director of the Office of Women's Health. Terry, thank you for coming today. And lastly, Dr. Shirley Payne. She didn't tell me about that part, but thank you, Dr. Shirley Payne. Nice to meet you as well. Dr. Payne is the Assistant Commissioner for the Public Health Protection Commission. And as I said, we're just really pleased to have all of you here. Certainly have an open welcome to come back to you as well, Dr. Box, anytime your heart delights. And hopefully we can do it at a time where we don't have to be concerned with COVID, but if that's the business of the day, then so be it, and we'll address it as we have. But thank you all for your efforts, and thanks for coming here today. Dr. Walker, I mentioned earlier, he always keeps us thoroughly informed of the latest medical and COVID-19 developments. To me, he's been one of the greatest resources for myself, certainly, but for all of us here in Gary, and I'm proud to have him on our team. I definitely have to re-mention Dr. Box for joining us. She came all the way down from Indianapolis, and working closely with Governor Eric Holcomb, Dr. Box has been a great source of scientific data and just a true public health leader in the state, and I'm certainly proud to have her here. As I said, all of the information that we provided earlier will be available on gary.gov, so if you missed anything, certainly visit our site and go back and get it. I've asked you to continue to check on your family members and neighbors, and you guys have done exactly that. You've watched out for each other, and for that, I thank all of you. And as I've said from the beginning, I know that if we remain calm and patient, and if we continue to look out for one another, that we will get through this together. Thank you for your attention this afternoon, and we look forward to seeing you soon. Thank you.